Hi, I'm Denise, a respiratory therapist and certified asthma educator with Nightingale Virtual Respiratory Care. Let's dive right in and talk about what is COPD. COPD stands for chronic obstructive pulmonary disease, and that is a combination of chronic bronchitis and emphysema. Some people may have more emphysema or more chronic bronchitis. Some people may have only one or the other, and the words kind of get used interchangeably. With chronic bronchitis, what happens? There's a lot of swelling in the lungs and a lot of phlegm being made. So in this model, you can see that there's a lot of swelling and some phlegm in there, and it's narrowing that airway, making it hard to get the air out. Compared to our model of a normal airway where there's no swelling and there's no mucus coming out. Now, so that makes it hard for people with chronic bronchitis to breathe, to get the air out because of that swelling and mucus. People with emphysema, on the other hand, have what we call floppy airways. Typically, your airway, it comes down and it breaks down into smaller airways and ends up in these little air sacs called alveoli at the end of your airways. They're covered with blood vessels, and so when you breathe in the air, the oxygen will diffuse or come through the membranes on the tissue on the lung, and it will go into your bloodstream and then get circulated throughout the body. And then it'll pick up the carbon dioxide and bring it back through those blood vessels again, comes into these little alveolar sacs, and then you exhale it. Now, people with emphysema have floppy airways. So instead of a nice round little sac at the end of their airways, they're going to have things that are going to look more like a deflated balloon. And so this is going to be floppy. It's going to be trapping air in here, making it hard to get the air out. You're not going to get a lot of nice diffusion of blood vessels with the picking up the oxygen and bringing it to the rest of the body and all that. So people with emphysema also have a hard time getting the air out. That's why we call COPD obstructive. We call it chronic because it lasts for a long time. It can last for years. And pulmonary because it's affecting the lungs. And then disease because it is a series of traits that are common to this certain chronic condition. And so people with COPD have a hard time getting the air out. They get short of breath. They have a chronic cough. And tomorrow we're going to go on and talk about what it's like to live with this chronic condition. So have a great day.